Well, you can see how comfortably this little thing next to me was able to move its leg with a little bit of support from me. Arthritis, something that you and I are bound to suffer from, whatever kind of lifestyle we follow. Does homeopathy have a cure for arthritis? One of the major afflictions that people above a certain age suffer from across the world. Let's find out in our next conversation, Homeopathy with Dr. Bakshi. So, arthritis. Am I condemned to suffer from it, or can you cure me?
Before we talk about arthritis, we have to understand what is arthritis, types of arthritis, and how to control it and manage it, and what is the role of exercise and diet. You see, arthritis is an inflammatory condition. Arthritis, itis means inflammation of the joints and muscles. When the pain is here in this joint, this is called frozen shoulder. When this is cervical pain, this cervical spondylosis is because of inflammation of the joints. And when the pain is here, this is called tennis elbow, golf elbow. This is slip disc L4, L5, S1. You have only one condition called inflammation. And pain in the ribs, people call it intercostal neuralgia. That is also arthritis of the ribs. Then you have cervical, as I told you, this is the area you have sciatica. Basically, it is not sciatica, it is pseudo-sciatica syndrome. And when the pain is here in this area, knee, called osteoarthritis. And when you have pain in the muscles called non-articular arthritis, called tendinitis, fasciitis, and whole body is called myalgia. Everywhere you find only one condition, inflammation, inflammation, inflammation. And you can very beautifully control arthritis if you learn from the day one that you need to do exercise. Laborers, people who do hard work, they do not suffer from arthritis. Please understand that point. Those patients who are not doing exercise, they are bound to suffer. They will suffer throughout their life through aches and pains. And arthritis can be seen from the age 2. When the pain is in the legs of the children, it's called growing pain. Mothers, they press the calf muscles and the patient says that the child is able to sleep comfortably. I have seen the same child when she grows up after marriage, after cesarean, after hysterectomy, after surgical interference, they develop arthritis. Whenever you give shock to the body, all hereditary symptoms come out of the body. So, when you diagnose a case of arthritis, it's very important for us to understand the family history. In the family history, you'll find arthritis on both sides, or one side, maternal or paternal side, and mostly it is associated with stomach disorders, with acidity. It is said that too much of flatulence, those patients who have too much of flatulence, gas, they tend to suffer more from arthritis. And when you massage the patients with oil, they start burping, like this. And you have to control acidity. Acidity has to be associated with arthritis. If you do regular exercise, you can control arthritis.
In this edition of Homeopathy with Dr. Bakshi, we're talking to the greatest living homeopath about arthritis. Now, is there only one form of arthritis, or can there be many?
See, I've already told you that articular and non-articular arthritis, and when you get pain here, any joint which is connecting the bone, this is called mandibular. Other day I had a patient who was having pain in the jaws, and that got aggravated because of extreme dietary irregularities. The patient was taking too much of cold drinks, was in the AC atmosphere, and then going to the atmosphere which was hot. Sudden change aggravates arthritis. And the moment we treated, again, when we treated the patient, when we diagnosed the history, family history was very predominant of arthritis. So you don't have to worry for arthritis from the day one if your family is having aches and pain. Even if the early symptoms, most of us do not know about this. Early symptoms are cramps in the muscles. You say, oh, my leg is stiff, and you're not able to sleep. When you're swimming, you suddenly develop a cramp. Frequent tendency of cramps is an indication you're heading for arthritis, and there's arthritis in your family. I have treated so many cases, thousands of cases of arthritis. Alone medicine will work, but if you do not do exercise, it will come back again. So you have to learn. In fact, you have to unlearn whatever you learn throughout your life. Who is your best friend in life? Exercise. Make exercise your friend. Do exercise. And when you do exercise, what you do basically? You improve the flexibility of the body. And which is the best exercise for flexibility is yoga. Learn yoga. All athletes on the playground, they do stretching exercises. This is nothing but another form of yoga. You stretch pain in the calf muscles. You will never cure with medicines. Only Paschimottanasana asana. You pull up your feet and you give a stretch to the calf muscles. Patient feels better. So exercise, diet, naturopathy. The things which block the channels of circulation, there are two types of food. One is vasodilator, one is which brings constriction in the body, like buttermilk, like starchy food, corn flour or maida. They block the channels of circulation. So avoid this food, take a lot of liquids, exercise, and I'm very confident you will never suffer from arthritis. Today, one thing is getting very, very common, the replacement of the different parts of the body. For example, knee joints. People are going for operations. But if, from the day one, if you see the family history, in the family history there is arthritis, and you start doing exercise. In fact, I am so clear, in the school it should become compulsory for all of us to do yoga. If you keep on doing yoga, you will never develop arthritis, and you will never suffer from, when the gap has reduced in the knee joints, when the gap has, this will not happen. This is called irreversible arthritis. This joint space is reduced and you have to go for surgical interference, removal of the joint. This also will give you temporary relief, will not cure your problem, because the cause is hereditary. If you give relief for 3-4 years or 5 years, pain is not there, the pain will shift to any other part of the body. So exercise, no surgical interference, even slip disc, L4, L5, S1. I have never failed. Give homeopathic medicine, give good yoga, and then the diet. Practically all cases are cured. But when you come to us in an advanced stage, your knees are damaged, then we cannot do anything. We can only help you in controlling so that it doesn't pass on to any other joint.
You're watching a special edition of Homeopathy with Dr. Bakshi. We're talking about arthritis. We now have an email that we have received from Latin America, and the patient wants us to take her name. Miss Rosa Gonzalez writes to us that she is a 54-year-old, otherwise healthy female, but she seems to have arthritis. She has joint pains, and her husband does not. He's 2 years older. Her question: is Mr. Arthritis somewhat biased in favor of women, or do men also suffer from arthritis?
See, I have seen that females suffer more in arthritis because of only one reason. They do not do much exercise. We men do a lot of exercise. All housewives especially, they suffer more because they're only eating, leading a sedentary life. They're putting on weight. You must control your weight. So it's seen that more females are suffering and males are suffering less. But it is equally prevalent in both the sexes if you have a strong history of arthritis in the family. If the mother is suffering from arthritis or slip disc and the father is also suffering from aches and pain, then you cannot save yourself. Then you will suffer throughout your life if you do not do exercise. And if you take homeopathy with naturopathy, exercise, I am very, very confident. I am honestly telling you, trust me, you can not only control, you can cure arthritis.
Ms. Gonzalez, you haven't told us if you have a weight issue. You heard Dr. Bakshi talk about weight and its relationship to arthritis. Let's ask him to explain a little more.
See, what are the main symptoms of arthritis? First is overweight, genetics, and stiffness all over joints. So why I insist on yoga, stretching exercises? Because it will improve the mobility of the body. It will make your body flexible. More flexible, less arthritis. And if you think you're walking for half an hour, it will help you. It will cure your arthritis? No. It will help you to some extent. But unless you do stretching, I'm repeating again and again, stretching exercises to improve mobility. And if you are able to do it regularly, even 5 times a week, for 20 minutes a day, you will not have arthritis problems. You can control all genetic disorders, especially of arthritis.
Well, while we are trying to do some exercise to see if my shoulder arthritis can reduce, although I don't suffer from it, the next question for Dr. Bakshi, he's talked about the relationship between diet and weight and arthritis. If someone suffers from arthritis, is there a particular kind of diet that he or she should focus on?
See, those patients who have acidity, burning in the chest, flatulence, and after eating they feel the heaviness in. First rule is not to overeat. Control your acidity. Question क्या था आपका?
About diet.
Diet में बोल चुका हूँ पहले.
No, what kind of diet? Vegetarian, non-vegetarian, meats, particularly. Does that have a relationship, Dr.
Red
Bakshi?
meat is not good.
So since Dr. Bakshi talked about the importance of exercise in either preventing or reducing the incidence of arthritis, I shall keep doing this as we continue our conversation in homeopathy with Dr. Bakshi. Is there a particular kind of diet, a particular kind of food that we should eat if we are at risk of arthritis?
Diet plays a very important role. You have to be very careful by not taking aerated drinks. I always tell my patients not to take Coke, Pepsi, Sprite, any aerated drinks. It's full of chemicals, preservatives, and the food that blocks your channel of circulation. Number one is buttermilk. In certain patients, I've seen curd. aggravates the condition. Indian curries, red beans, kidney beans, and maida or corn flour should not be taken. And one more thing, you must sleep early. All arthritis patients, they tend to feel sleepy the whole day. Why? They need only 20 minutes nap, little siesta. They feel immediately energetic because the muscles are inflamed. All muscles are inflamed and they need rest. They cannot tolerate late nights. So you should be careful, eat early, don't overexert, and take plenty of sleep. And muskmelon, watermelon is poison for arthritis patients. Anything which produces cold in the body should be avoided. And with food, exercise, again I'm repeating, is important.
So while Dr. Bakshi has been talking, I have been exercising my neck and my shoulders. But am I barking up the wrong tree? What parts of the body, your body and mine, are most likely to be affected by arthritis? Homeopathy with Dr. Bakshi.
Practically every part of the body, muscles. I'll give you an example. I have a human skull with me. Now, the skull is joined by this small
The issue.
question is alcohol, especially beer.
Begin.
You see, arthritis is seen in every muscle, every bone. You feel in the ankles, you feel in these small joints. This is called polyarthritis. You see it in the skull. This skull is joined by many small bones. See, all this. And when you have inflammation, these sutures of the skull, they get inflamed. When they get inflamed, you get headache. So we have now discovered that migraine is nothing but part of arthritis. Pain, head, rheumatic. Our forefathers, Dr. Kent has shown in his book, it's written in his book, that headache is a part of arthritis. And it was discovered in my clinic about 30 years back when I was treating patients for arthritis. Their pain, the headaches, the migraines were reduced. Then I started reading and I found it's written in the books that this is nothing but arthritis of the skull. So you can have pain in the skull, on the mandibular, on any small joint of the body. And when you have the best way to diagnose is hereditary. I always say hereditary factor is very, very important. My work is on genetics. Everything is hereditary. Saintly parents produce saintly children. Offspring of criminals, their children have to have the same traits. If you have a strong history of allergy, arthritis, stomach disorders, skin and respiratory, you can suffer. And I'm asking one plain question to all of you. Show me one family who does not have arthritis, who doesn't have skin problems, who doesn't have stomach disorders. Out of the four, you'll find one, skin, respiratory, or stomach, and arthritis will be there in all the families. I have raised these questions in very big seminars, and majority of them have said, that is, I say, we are all walking pathological labs. There is one chronic disease lurking in the body, in this skin, respiratory, stomach, joints, and arthritis is becoming very popular. It's in fashion, the knee replacement. You can avoid this. You can avoid slip disc. There's no need for any surgical interference. The complication of slip disc is foot drop, the paralysis of the foot. I have patients who are orthopedic surgeons themselves. They have taken homeopathic medicine, they have cured their slip disc, and I have given them advice of yoga and diet. So homeopathy has excellent treatment for arthritis.
Dr. Bakshi told us about certain kinds of foods that should be avoided if you are likely to suffer from arthritis. Some of us might want to know, what about that little brown liquid we enjoy in the evenings? Can one have alcohol if one is a potential sufferer from arthritis?
That's a very good question. I forgot to answer. You raised this question. Alcohol is bad for arthritis. I've seen those patients who take alcohol, especially beer, because the effect of beer is cold. It numbs your body, and it must be stopped immediately. You should not take alcohol. Alcohol is bad for arthritis. Avoid red meat also. Red meat is also not good for arthritis. Take more of vegetables and don't overeat. Don't block your stomach. Eat less. So diet, especially alcohol, should be controlled, should not be allowed to arthritis patients.
Homeopathy with Dr. Bakshi, and you have heard the good doctor tell us that good food is bad for arthritis, good drinks are bad for arthritis. Now, what are the bad things that are good for arthritis? Young women, particularly those who have entered the menstrual cycle, sometimes complain of severe abdominal and other pains during their periods. Is that also related to arthritis? We're talking with Dr. Bakshi on Homeopathy with Dr. Bakshi.
There's a very common word called dysmenorrhea. Dysmenorrhea means painful periods. And this is seen more in patients who have arthritis in their family or arthritis constitution. It's written very clearly in the books, pain, uterus in rheumatic constitution. This is written in our Kent's repertory in homeopathy. And this again, I have verified and treated patients of arthritis. The moment I treat them for arthritis, the dysmenorrhea gets better and they get controlled, they get cured. And then I saw, which was an accidental proving, that dysmenorrhea is nothing but arthritis of the uterus. It can be controlled, it can be cured. And people, the girls, they suffer a hell of a lot. I've seen patients suffering for 10 years, 15 years. And when they take homeopathic medicine, practically majority of the patients, they get cured of dysmenorrhea.
We're talking about arthritis. Can deficiency of things like calcium or certain vitamins aggravate the condition of those who suffer from arthritis?
There's a condition called osteoporosis. When the calcium is thrown out of the body, if that happens, you can develop fractures very easily. When you have a small fall, you can get fractures. Vitamin D deficiency is becoming so common that especially in urban cities, people are taking oral calcium. I feel when they do exercise, they take homeopathic calcium. We have excellent homeopathic tablets in homeopathy, and take constitution treatment, patient gets better.
We have another question, but this time it's from Indonesia, from a male 47 who asks, can homeopathy cure my declining eyesight or arrest it? That's a question that we will have to respond to in a subsequent... What do you want to talk about? Harpreet, you said about painkillers? Okay. We have another question sent to us by email. This time it's from a 47-year young male from Indonesia. And the question is, I suffer from pain of the joints and am often prescribed painkillers. Is that good? Dr. Bakshi.
Remember, all painkillers are crude medicines. They are going to have some side effects. If you keep on taking painkillers for a long time, I remember one patient taking aspirin for a very long time. She was a very famous singer and she was very busy. She used to take 4 tablets 3 times a day. This is about 30 years back. And her kidney failed. Her kidneys failed and she died. Then her ribs developed cracks. The back got collapsed. And finally we were not able to help her and she died in the bed. So please don't abuse too much of painkillers. They are bad for you. They will produce some side effects. Go for complementary or so-called alternate system of medicine, homeopathy, naturopathy, yoga. It will work. Don't hesitate. Remember one thing, if some homeopath has not been able to cure you, homeopathy has not failed. The homeopath has failed. Try some other homeopath. It will work.
We trust that you have learned a little bit more about arthritis and how homeopathy can help you control it and possibly even cure your condition. We have been talking to the greatest living homeopath based in India but a citizen of the world, Dr. Sunny Bakshi. Homeopathy with Dr. Bakshi, and we are looking forward to your questions that you can send us at cure@bakson.net. I repeat, cure@bakson.net. In our next edition of Homeopathy with Dr. Bakshi, we will be talking about something that might just surprise you. So don't forget to join us again in the next edition of Homeopathy with Dr. Bakshi.